Hello, and welcome to all of you from Geneva, where we're having the World Health Assembly. I'm Polly Dunford, President and CEO of IntraHealth International. At IntraHealth, we're working to be proactive, to help shape the future we all hope for, and to support those on the front lines of global health during these fast-moving times. We work with health workers all over the world to help shape our vision, which is that everyone, everywhere, has the health care that they need to thrive. We invite all of you watching to join us in these efforts to shape the future we all want. We created SwitchPoint Future League as an extension of our SwitchPoint gatherings to focus on the future and focus on the next generation of leaders who will lead the way. It has been a tremendous pleasure to work alongside these young leaders, together with Global Fund and One Africa, to hear their ideas, their vision, and to be inspired by the future that they want. This SwitchPoint is their SwitchPoint. Youth voices matter. And we want to make sure that their voices are heard in policy decisions, funding decisions, and future planning forums like the World Health Assembly this week. Thank you, Future League. Thank you.
Hello, everybody. It's my great pleasure to introduce the Future League, a group of inspiring African youth advocates who have been participating and engaging with the all-important conversation of how healthcare systems are financed in their home countries. There's no other continent where the time for these discussions is more right and necessary. Africa faces the highest per capita disease burden and has the lowest per capita GDP. As a result, over 70% of the Global Fund's roughly 4 billion annual investments are into African healthcare systems. The diseases the Global Fund is working to end disproportionately affect the youth, both directly through mortality and indirectly by keeping children out of school for extended periods or forcing their families into poverty as a result of impoverishing healthcare costs. Malaria, for example, is responsible for as much as half of the missed school days in highly endemic areas. In much of Africa, this combination of high disease burden and low resources means that decisions and policies which govern the allocation of these resources are all the more important for the health of Africans, and especially the youth. It's important to know that when we talk about health in Africa, we're inevitably talking about health of the youth. Over 60% of the continent's population is under 25, and this at a time when most other regions in the world are seeing aging populations. Africa has to realize this demographic dividend to accelerate its economic development, but without healthy youth, this dividend will turn into a burden. Realizing this dividend begins with well-resourced, efficient, equitable healthcare systems, which follow from well-formulated health financing strategies. We need a broader, more inclusive, a louder conversation about health financing in Africa. The Global Fund or any other organization cannot achieve this alone. We will need to harness the energy and commitment of the youth to take back their future. And initiatives like the Future League serve as a tremendous platform to this end. Thank you.
Welcome to SwitchPoint. I'm CJ Sood. I've been hosting SwitchPoints for a long time, but this one is different. This one is created by young people. I've been talking with them about story and life and impact and advocacy. And they're coming back to me with ideas and energy and exuberance. So hello and welcome. This is the SwitchPoint Future League Virtual Exchange. SwitchPoint is where humanitarian innovation, global health, and technology collide. We believe in the alchemy of diversity and unusual connections to change points of view, to find new solutions, and get things done to manifest a healthy future for all. SwitchPoint is produced by IntraHealth International, a global nonprofit working towards the next generation solutions in global health with programs that generate long-term social and economic impact around the world, and an unwavering commitment to frontline health workers. The Global Fund is the world's trusted, proven partnership, fighting major infectious disease at scale around the world, playing a critical role in the global response to COVID-19 in the poorest and most vulnerable countries. Today, you will hear from global leaders, youth leaders, artists, economists, policymakers, and strategic future forecasters. Here are a few moments from in-person SwitchPoints and other SwitchPoint virtual exchanges to give you a flavor of this unusual gathering.
The future I want is a future that meaningfully engages young people of all diversities.
I look forward to a future free from discrimination and marginalization.
The future I want is a future where there is freedom for everyone, rights for everyone, and where young people can fully achieve their potential.
We have to do everything we can to remove those barriers and to physically put in those structures that will allow everyone to be able to access the opportunities with which we can solve today's problems in readiness for tomorrow. And we can't do that if we don't collaborate.
We and the broader Global Fund community are acting with urgency to help countries respond to COVID-19, but also to take action to mitigate the knock-on impact on other diseases such as HIV, TB, and malaria. We need to see the same kind of mobilization, the same changing of the rules around the way science interacts with politics, interacts with communities, the way people across the globe coordinate and work together if we are going to get an effective response to this crisis. And that needs people like you.
The future is also young, in fact, very young. I want a future that embraces and acknowledges young people.
The future we want at IntraHealth is one where young people see themselves as leaders in the fight for global health.
So it's up to us as humans to come together, to join our hands, your small and my small coming together and creating this big thing that will eventually shift the way the world is known to be.
SwitchPoint gatherings have been taking place around the world in person and virtually, bringing together the brightest thinkers, leaders, artists, and entrepreneurs from multiple industries to innovate and collaborate on solutions in global health, humanitarian innovation, and technology during these intense times. We stretch beyond the bounds of just global health to recognize an increasingly interconnected and challenging world, bringing the strongest ideas, lessons, and creators from multiple industries to the realm of global health, and we demonstrate the deep impact of global health on the world's most critical issues. After COVID-19, that's not as hard to explain. Health equity, health workers, and health financing impact all of our futures, affect aspects of our daily lives, impact political decisions and autonomy and economies, creativity, and entrepreneurship. Health is a fundamental human right, but we have a lot of work to do to make sure everyone, everywhere, can survive and thrive. How do we want to reach the future we want? It's time to listen to the experts and the architects of the next generation.
Nothing about us without us.
The SwitchPoint Future League. SwitchPoint is normally produced by IntraHealth International and the SwitchPoint team, but today, this virtual exchange has been created, imagined, and produced by the talented young leaders who make up the SwitchPoint Future League, with support, partnership, connections, and ideas from the Global Fund and guidance from the One Campaign in Africa. 6 outstanding young leaders from 6 African countries were selected by teams at IntraHealth, the Global Fund, and One in Africa to form the first SwitchPoint Future League, a consortium of young people leading the way towards a healthier future. Members include a young drone pilot delivering medications to far-flung locations in Malawi, a health economist looking at future forecasting, local autonomy, and domestic financing from Zimbabwe, an epidemiologist and global health security specialist from Cameroon, a cutting-edge multimedia artist, poet, and dancer from Rwanda, a renowned singer-songwriter from Nigeria, and a young nurse, a national activist who was also Miss Universe in Kenya in 2021. Together, they are using their unique voices and perspectives to raise awareness and engage their peers and world leaders about the critical importance of prioritizing health, health financing, global health security, and health access and equity for all. Throughout this year, they have been sending in video transmissions and talking with their friends, families, policy leaders, kids, artists, advocates, and officials to learn more about what needs to happen to manifest the healthy future we all hope for. Today, they're gonna take us through their latest adventures and ideas. They have some hard questions for leaders, and they wanna know your ideas for making sure that youth voices are heard and amplified when it comes to decisions about their future and their health. Let's hear from the young people in a context they create and control. It is my honor to introduce the Future League.
My name is Zipporah Iregi, and I'm really excited to be having this conversation with you at this moment in time. I am a young nurse based in Kenya, and I'm privileged to be part of the Future League program organized by IntraHealth International and the Global Fund. In my work as a nurse, I've been able to see members of my community who have not been able to afford healthcare services. And once they gain access, some of them have not been able to pay for the healthcare services that have already been provided to them. Question is, who pays? What is healthcare financing? So I hope to raise awareness on healthcare financing and call on governments, individuals, well-wishers, philanthropists, NGOs, and the public in general to come together and let us find solutions to healthcare financing. Let us ensure that you and your children are able to afford healthcare, because health is a basic right for you and me. So I hope you are going to join me and my colleagues in this journey.
Hi, my name is Sil. I'm a singer-songwriter based in Lagos State, Nigeria. As you know, I'm one of the 6 young African leaders that were selected for SwitchPoint's Future League, and I am so excited to be part of this project. I am here as part of Future League 2022. The aims of this project are basically towards stronger global health security, an equitable end to the global COVID-19 pandemic, making domestic health financing a priority, better, more widely available health services for all, support for the health workforce and health innovators of the future, including fair pay for health workers and an end to volunteer model in community healthcare. I am a voice at the table for youth in all policies, national and international, regarding health. I am very honored to be a part of this.
Hi, my name is Yared Nagash. I'm here in the beautiful and sunny Harare, Zimbabwe, and I'm so honored to be a member of the Future League. To tell you a bit about myself, I'm a health economist working at the Global Fund, where a core theme of our work is how we can support countries around the world, but especially in Africa, to prioritize health and healthcare spending. I grew up in Zimbabwe, and this shaped my outlook on the value of good health and led to me studying some of the tools used to inform healthcare decisions. But the reality is that these decisions often come down to money and political will. I'll be putting a spotlight on how Zimbabwe finances its healthcare system and why this is so important for the health of all Zimbabweans, but especially the young.
Hello, everybody. My name is Deborah Ntambalika. I was born and raised in Malawi. I'm a drone pilot at Wingcopter German drone startup company doing drone delivery service in Malawi. My experience with drone technology showcases the value of drone technology innovations in strengthening and complementing the healthy supply chain systems in Malawi. For I will openly share my knowledge and perspective about drone technology towards supporting the health workforce and promote young health innovators for the future.
I am Dr. Franklin Servidum Wisi, a Cameroonian and global health expert by profession. As a young African leader, I'm thrilled to be a future leaguer with the IntraHealth International SwitchPoint, Global Fund, and One Campaign Africa initiative. Today, millions of people, including youths, do not access health services due to costs. Many even die as a result of limited finances. Defeating the three epidemics of HIV, tuberculosis, and malaria that cause most of these deaths is a call for concern. In Cameroon and many other African countries, especially amid COVID-19 pandemic disruption. In addition, our national health systems need to be strengthened in order to respond to emerging and re-emerging pandemics. Being one of the youth advocates that is championing the call for African governments to increase their health financing means a lot to me and my community at large. I represent the aspirations of many people, adding to their voices, calling for African governments to engage in improving their health financing. Lastly, my advocacy symbol is the light bulb, which signifies to me great and servant leadership, solving problem behaviors, delivering new ideas, team effort support, and supporting lighting the path of others through mentorship. I am the future. We are the future. And the future starts now. Let's light up together this future. Thank you.
I am me plus you minus ego. I'm the space in between the lively and the lifeless. I am presence and I am present. I reset my preset conditions. I deny the false accusations with my truthful living. I'm excellence when mediocrity is the set standard. I'm the no when yes is forced on my tongue at gunpoint. I am the rebel, the misfit, the spoiled one. Spoiled because I question, and I question because truth has been tucked under the warmth of the lie. I am the challenger of the I. Understand I in itself means I ain't you. I refuse the limits of language. I'm the dance and the dancer. I am sound. I'm the voice that sings life amidst death. I am death. I am life. I am singular. I am plural. I am you. I am.
Prepare is to put every single thing that I need to get on the next level of my journey.
What does it mean to prepare?
Basically, I would say putting yourself in the right mindset or mind frame and, putting in work.
My name is Ambibiola. I'm a nursing student. For me, being prepared means that after my studies in the medical school, the healthcare system should be structured in a way that I'll be able to take care of as many patients as possible without the fear of who pays bills or not. Moreover, I should be able to provide effective, efficient, accessible, and equitable healthcare to all across the health continent.
My name is Kwete Patience. I'm a medical laboratory student. For me, preparedness means I should be ready to respond as a frontliner with adequate resources held in place in case of any disease outbreak.
My name is Munya Aibu Jr. I'm a young Cameroonian studying dentistry. For me, preparedness means that by the end of my studies, the government, through the Ministry of Public Health and its partners, make sure that universal health coverage is fully implemented, while making sure that the promise of health equity is achieved, such that people get quality health services at affordable costs, including dental services of quality, as in patient needs. Thank you.
My name is Karangan Ruben. I am a young Cameroonian studying pharmacy. Preparedness for me means receiving quality education, oriented towards a more public health aware market, such that the knowledge and skills which I acquire will enable me to make immediate contribution in the domain of health policy, including health financing, while advancing in my career in global health.
I am Wisi Jean-Claude, a young Cameroonian studying pharmacy. To me, preparedness means that the government should initiate, develop, and improve on medicine and vaccine production in-country, managed by well-trained personnel. This is going to save money for the government, and it's also going to make people to be aware that we are not just pharmacy salespeople, despite our great training in school. As a pharmacy student, I would like a future where people are not giving up on their health due to inaccessibility to medicine and how expensive drugs are. Thank you.
As a youth advocate, the effect that COVID-19 pandemic will have on our future healthcare systems is such that our healthcare delivery will allow for the adoption of new care models. Rising acuity, that's overall increase in chronic diseases and comorbidities as a result of the pandemic, virtual and digital health solutions will influence our health financing. Also, we'll need to understand our future clinical demands so that it orientates us in the workforce development and planning for health resources. Health is wealth because healthy people drive strong economies. If we are not prepared, we are going to fail. Preparedness for me lies in seeing Cameroon restructuring, redefining its health financing system so that we move more rapidly towards universal health coverage and sustain its gains. This is going to considerably reduce the out-of-pocket health expenditure, which stands at 73% in Cameroon, very high, and also will strengthen our national public health security. Furthermore, we will have to review where we are in terms of universal health coverage and how our health financing systems are functioning with these mechanisms. Our strategies and policies for healthcare financing are ideally through a multi-stakeholder perspective involving all key players like the Ministry of Finance, etc. We'll have to monitor and evaluate the progress of these policies in place and make sure that they are moving. And lastly, we are going to try to achieve all the three goals of universal health coverage: quality of care, equity in the use of health services, and financial protection. It's not going to be easy, but together as a nation, we are going to make that happen. I am the future. We are the future. Together, let's light up the future.
As young innovators, we need to come together to find solutions for all. We have received guests from across by nursery school. These kids, they would like to understand what's the difference between a drone and airplane.
So my question is, why do you think young kids need exposure to new technologies, whether in IT innovations or other digital solutions to improve the health status of Malawi?
Okay, thank you. So from my experience as a young kid, as I was a young kid growing, and from my experience now that I'm working with young kids, I feel like it is very, very, very necessary for kids to know exactly what drones is, computers, and also technology in general. It's a very impactful knowledge, because I do remember myself going to college and first learning about coding. So I was given or we're learning about C++, and then it was news to me. I didn't even know what to do and how to maneuver around code. That is because growing up as a young kid, I didn't get exposed to computer programs. So I do think that innovators and people that are innovating within the technology, with the health sector, health technologies, should get themselves immersed in machine learning, because it's a very important tool towards avoiding future pandemics.
In Malawi, 82% of Malawians are living in the rural areas. This means that most of the health workers are located remotely. In my perspective, as youth, we have to have a collective means or sustainable solution to help these health workers by equipping them with enough resources to help diagnose diseases in the right time and receive health commodities such as essential medicines, vaccines, even sputum referrals in the right time.
Does a prepared healthcare system mean that it could deal with a pandemic? Maybe even one that epidemiologists were warning about for years? Well, we need to look no further than the last 2 years, where some of the most advanced healthcare systems in the world were brought to their knees because of insufficient hospital beds, ventilators, PPE, you name it, and there was probably a shortage. So perhaps it seems unrealistic for us to expect that we here in Africa could be prepared for a pandemic like COVID anytime soon if some of the richest countries in the world weren't. But we will need to be, because there will be another pandemic. But future pandemics aren't the only thing that we should be prepared for. There's the ongoing epidemics of HIV, TB, and malaria, the rise of non-communicable diseases like diabetes and heart disease, and of course the growing of African economies. And this last one may have taken you by surprise. And it's for the simple fact that as African economies grow larger and larger, donors tend to give less and less money. And this is because countries are expected to fund their own healthcare systems. And the amount of support provided by these donors is not trivial either. In Zimbabwe, over 1/3 of the total health spending was done by donors. In 2018, it was more than half. So how are we going to prepare for this gradual but eventual decline in support from donors and make sure that the progress that has been made is sustained, because eventually the tap will run dry? And I'll be out of a job, but I'll gladly accept this if it means that we have a well-equipped healthcare system. And for me, this drives at the heart of what a prepared healthcare system should be, and it's one that's sustainably financed, one that doesn't increasingly rely on external sources of funding, even when economies are growing, one that doesn't require the poorest and most vulnerable to pay out of pocket to weigh up getting essential medical treatment versus feeding their children. Preparing starts with making sure that we have enough life-saving drugs, enough bed nets, enough well-trained health workers, and all the other ingredients of a well-resourced healthcare system. And this can only happen if our leaders invest more in health, because all these ingredients cost money, but they don't cost nearly as much as they cost to neglect.
What kind of healthcare do you envision for the future? And something we need to realize is that we cannot wait 30 years down the line to start that conversation or to begin the journey towards building a better healthcare future for all. The conversation and the journey begins now and begins with me and you. And something I'm personally doing to prepare for that future as a young person is ensuring that I'm continuously learning and growing and developing, gaining the necessary skill set and knowledge that I need to be able to infiltrate leadership positions and to be able to make sure that my voice is heard and to amplify my voice as a young person, and I'm learning from those who have gone before me, drawing from their experiences, learning from my peers, and also learning from my younger colleagues. And not just learning and growing, but also passing this knowledge to younger nurses who are coming up behind me. And we have been having a mentorship program run for young nurses in Kenya since 2019, just to ensure that we are leaving no one behind in this conversation. Make sure that we are also encouraging them and inviting them to use their voices, because their voices are important, and your voice is important. So another question to you is, how are you preparing for that future of healthcare that you envision?
Fund. There's many different ways to fund a healthcare system. Different countries use different strategies. Some rely mostly on out-of-pocket payments. Others rely mostly on health insurance premiums. Others rely predominantly on payroll taxes. There's many different ways to fund a healthcare system, but the balance of these different sources has an effect on both the effectiveness and the equity of the healthcare system. And by extension, this has an effect on the health of the population. And here we can see that Zimbabwe's government is mainly relying on people paying out of pocket for healthcare services and on foreign aid. You don't need me to tell you that this isn't a sustainable way to finance a healthcare system. But this is only one part of the equation. Maybe before asking how we fund the healthcare system, we should ask, do we fund the healthcare system? And while there's no magic number to tell governments how much to spend on healthcare, there are a number of useful benchmarks. And one of these benchmarks is that governments should spend about $86 per person to get essential medical services. Zimbabwe's government only spends about $18. Another benchmark is that government should spend about 5% of GDP on healthcare. Zimbabwe's government only spends about 1.4%. And another benchmark is the Abuja Declaration, which says that government should spend about 15% of total expenditure on healthcare. Zimbabwe's government only spends about 8.7%. So it doesn't matter which benchmark you take, Zimbabwe's government doesn't spend enough on healthcare. And this isn't only true of Zimbabwe, this is true of many African countries. They simply aren't spending enough on healthcare. And why is this the case? Because we know that healthcare keeps children in school longer. It keeps people out of poverty. It helps the economy. And that's why I think initiatives like the Future League are so important, because it allows us to urge our governments to spend more on healthcare, to spend more on the youth, because their health is pivotal for the future of all our countries. So let's urge our governments to spend more on health.
It's about training in the whole nation. It's about the vision. It's about leadership. You know, what I've been saying, you can put it under governance. It's about the governance structure in the nation. How are the systems governed? What are the values? If those things are not made clear, and if people cannot distinguish between their private pockets and government pockets or common good, then there's always a problem.
What a proper funded healthcare system looks like to me is a funding that does not just focus on equipment or putting up new facilities, but also takes into account the healthcare worker, their remuneration and well-being. And not just that, just ensuring that the environment supports them, the system supports them to thrive at every level of healthcare they are in, because there's no healthcare system without the healthcare worker. And finally, I believe that yes, we can plan for funding, and this needs, again, like I said, a collaborative approach for each and every one of us, where we start at the community level and carry out a needs assessment, going up to every level of healthcare. And this will help us be able first to identify the urgent needs for healthcare. Second, to identify the areas with which money has been unnecessarily spent, and could also help us to be able to understand how to then distribute those funds to ensure that healthcare is accessible and affordable for each and everyone, in line with the SDG number 3, achieving good health and well-being for all. Thank you.
When it comes to funding, when it comes to money and resources and how we use them, ultimately it's a choice, and I think every government has these choices to make, and how much do they allocate to what. And of course, our main concern here is health and healthcare and health workers. So how much funding is allocated to them? I think that this is where really we have to question our priorities, because as they say in many African proverbs, I think, or even everywhere else, health is wealth. So yeah, basically you can only enjoy the wealth or the fruits of this life when you're healthy. And so it should also be that way when we're spending, when we're thinking of spending. How can we spend in a way that how do we allocate money in a way that's going to help sustain our lives? How do we allocate funding in a way that's going to sustain the lives of those who take care of us? So from this pandemic, I think we have learned that being well prepared for anything is vital, and especially a health crisis is vital. Being prepared for a pandemic is vital, and that's why it's important that we encourage our leaders and our governments to allocate a respectable amount of our funding, of the people's money, into their own well-being.
The Future Leaguers went to schools and coffee shops, offices and galleries, headquarters and Zoom meetings, and they've impacted each other. And that's part of the goal of SwitchPoint, letting ideas from others begin to change and expand your own personal switch point of view. If you thought Syl, the recording artist, was going to sing, you might be surprised when an epidemiologist hits the recording studio. Hit it, Franklin.
Future League! Yeah, we are the future leaders. We want to be the voice of the voiceless. We want a healthy future for everyone. We're taking a stand for the young people, cause health is forevermore our dream. Come on, JC, Seka.
We all need each other. The love we can share is stronger than the hate. You reap what you sow always. A soul with a purpose can deliver dreams. Yeah. It's a revolution coming. Are you standing on the side that craves change? Young boy hustling. He got big dreams that ain't gonna come true if he unwell. He gotta be well. Young girl hustling. She got big dreams that ain't gonna come true if she unwell.
Dream. Everyone is a dreamer, but I dream of Malawi that provides cheaper drone delivery services to the 80% of Malawi living in the rural areas facing difficulties in accessing health care. Digital technology and drone technology have become popular in the 21st century. For example, mobile technology. In Malawi, mobile phones were introduced in 1998. In 2014, 70% of Malawians had access to phones. In 2019, a phone was used in voter verification, including those in rural areas, which means that digital technology is being reliant upon in huge data capture and sending messages. Taking advantage of the mobile technology, health organizations now use telecommunications networks to disseminate information about health. For example, UNICEF Malawi sent messages about COVID-19 vaccines and polio vaccine campaigns, warning and reminding citizens in the incoming COVID-19 waves and the precaution measures put in place. In 2017, the first humanitarian drone corridor was opened in Malawi. Over time, more than 5 drone companies started to operate in the corridor. Having said this, I personally dream of becoming a health innovations director. I would like to see drone technology courses introduced in the technical colleges, which will eventually increase youth involvement in invading the aviation industry in Malawi, and over time, at the same time, providing sustainable health care for all in Malawi.
And it may be very difficult to dream in these times, to actually think that yes, times can get better. Considering COVID, they had financial times that followed. After that, what is going on in Ukraine and other matters that are happening in our environment. especially for us young people, I am here to call you to dream big and to challenge your colleagues to dream even bigger, because yes, we can achieve that kind of future we want to. And at this moment in time, we need to be building ourselves, creating that capacity, learning the proper technology, finding solutions for the now and the future to ensure that we have a better future for healthcare, even as we look towards achieving good health and well-being for all.
You ever had a dream that dreamt you, a spirit that embodied you, a message that wanted to pass through, a voice so loud, a vision so clear, a team so gigantic yet so humble, beauty ready for creation, history to be passed on, a meeting of two parallel lives perhaps, reincarnation perhaps. Well, we always were, we always will be, inhabiting, living, doing and redoing, learning, sometimes not learning, repeating, sometimes finding new ways. Either way, we are here, sharing our views, exposing our experiences, showing us so you see you. May you read your eyes, may you tune in your senses, may you share your times, perhaps your coins, may you coexist alongside us.
I'm at Trinity Bilingual Nursery and Primary School, Douala, Bonaberi, Cameroon. And I'll be asking children what they want to become in future. That's their dreams. And Janelle, what do you want to become in future?
Doctor.
A doctor. Wow, she says she wants to become a doctor in future. Paul, what do you want to become in future?
Become a footballer.
Wow. Paul wants to become a footballer in future.
My name is Vesife Ragnar Edwin. Visit Simbon Fanyon.
What do you want to become in future?
I want to become a nurse because I want to help people suffer from diseases and give them medical care.
Beautiful. He wants to become a nurse and help people suffering from diseases while giving them good medical care. Beautiful.
My name is Ngong Babara.
Wow, beautiful. What do you want to become in future?
A computer engineer in future.
Wow, she wants to become a computer engineer. That is amazing.
Good morning, sir. You are welcome to class 5. Education is strength.
Name?
My name is Mabong Tamira.
What do you want to become in future?
I want to become a doctor.
Why you want to become a doctor?
I took the decision of becoming a doctor because doctors take away the pain and suffering of others by giving them medical treatment and health care. Also, as a doctor, I will become the continuous source of happiness for many people and their families. See, when you give happiness to others, you are the happiest person at that moment. If you don't believe me, then try it.
Wow, that is amazing. Can we clap for her? What do you want to become in future?
I want to be healthy.
Wow. What do you mean by you want to be healthy?
I want to be healthy because being healthy helps our self-confidence and self-esteem. Being healthy is like a profession because of the presence of tropical diseases like malaria, cholera, yellow fever, which claim thousands of lives every now and then. So being healthy is being wealthy because I can practice any profession as far as I am healthy. Thank you.
Wow. Can we clap for him? Good, good. This is so amazing. I mean, this is one of the best things I've heard in a long while. He says he wants to be healthy when he grows up. We all have to do our best.
put in the financial resources, the enabling environment to see that this child has a healthy future. As a youth advocate, I'm happy I was able to talk to these children who are the future leaders of Cameroon. Lots of children say they want to be doctors when they grow up. But as they grow older, they realize that being a doctor is more than being superheroes in white robes. It takes the enabling environment, financial resources, etc. Some of their dreams even end before it begins. Dreaming in this time is fascinating. I have a dream that one day in Cameroon, digital or mobile technology will positively influence the way we use and pay for healthcare services. A dream where domestic health financing measures will play crucial supportive roles in rapid and efficient response to disease outbreaks. A dream where youth voices and their ideas shall be highly taken into consideration for health policy making. A dream where no one shall be left behind, because our health policy shall ultimately focus on strengthening our health security, our national health system's resilience, and universal coverage for all. These dreams are such that our government shall raise adequate revenues for our health systems while maximizing accountability and making sure the funds are adequately used to improve the health of all Cameroonians. In conclusion, it's not going to be easy to create the reality of these dreams, but I believe that with the spirit of humanity, the love for goodwill, and solidarity, we shall overcome.
It's beautiful to dream big, but don't let it end there. Write it down, plan, do not let anything stop you. Take it one step at a time. But my friend, reach your goals.
What it means to manifest. I was asking myself what it really means. I think personally it would mean exhibiting who you really are. Being at a place where everything that you've wished for, all your dreams, your goals, your desires are showing forth. Like you're reaching your goals, you're acing your targets.
So when you say manifest, the first thing that comes to me is intrinsically what is. Because it's actually what exists that you bring out. At the time of bringing out what exists is when the intersect of the word manifest happens. You manifest something that process has gone over. You manifest something that has been cooked and prepared and made ready for the world.
Manifestation. I think manifestation comes when we align our thoughts, our words, and our deeds, our actions. I think manifestation is one of the powers that we have as human beings to co-create, because we are all creators. We all have this creative energy and force within us. And manifestation is one way of creating, of making sure that we tap into our God nature and our creative nature and make sure that this thing appears.
Manifesting our plans and dreams for a healthier future. That is making clear evidence of the understanding of how African governments, with case study being Cameroon, can improve their health financing. That is ensuring that health is accessible, affordable, and of quality according to individual needs. The following will have to be done. 1. Respecting the terms of the African Leadership Meeting 2019, that is the Addis Ababa Declaration, which stipulates that we need to improve the status quo of health financing, increase domestic funding for healthcare in a more efficient and effective manner, allocating at least 15% of our total government budget for healthcare as stipulated by the Abuja Declaration 2001, obtaining specific resources from communication and banking companies for healthcare. Example is the 0.2 increase in mobile money transactions in Cameroon. Part of this money can be specifically dedicated for healthcare in Cameroon. Also, getting tax proceeds from beer and cigarette production companies. This will help in saving lives. Subsidizing health financing through conventional associations, that is faith-based organizations in Cameroon. We have the Baptists, the Catholics, the Presbyterians, etc. They have health facilities in many rural areas and hinterlands where few government facilities may exist. This will bridge the gap of inequity of healthcare delivery. Also, train medical personnel through quality control mechanisms.
retain them, and make sure they are well paid. Also, enhance strong policies that encourage and ameliorate their push forces, that is, forces that want to make them leave the country, and ameliorate the pull forces that will make them work and stay in Cameroon. This is going to reduce the patient to health worker ratio. Train medical personnel by building state-of-the-art hospital training facilities and pharmaceutical companies. This will make their medical training more pragmatic. Develop front lines using integrated public health security training curriculums and implementing context-specific national action plans for public health security, which is critical for making sure that we prevent outbreaks from becoming large-scale epidemics. Lastly, continuous sensitization of IEC, that is information, education, and communication of the importance of healthcare of a country, and making sure that the message of universal health coverage is clearly understood. Universal health coverage does not mean free healthcare, but that out of pocket will be considerably reduced and will align us with the future of healthcare we want.
So we have had a good run, as we have discussed our dreams and hopes for the future, how to prepare for that dream, and asking ourselves, how then do we fund that dream? So finally, today we tackle how this all manifests in the future. And I have said this before. I am going to say it again. The only way we get there is through a collaborative approach. I cannot get there alone. No individual country can get there alone. No individual continent can get there alone. It is important that we feed off each other's strengths and also challenge one another to improve on our weaknesses. And so once we improve health, once we come together and find solutions for the now and for the future, once we build on our own strengths, once we build capacity within ourselves for the future, and actually improve health, achieve UHC, this will inevitably have a ripple effect even towards the achievement of other sustainable goals. I believe it's going to happen. Do you believe?
Okay. Just messing with you. Sil is gonna sing too.
Hi everyone, my name is Sil. I'm a singer-songwriter from Lagos State, Nigeria. What's up? So the first song we're gonna be singing is a song that I wrote. It's titled, we don't have a title yet, but it's basically a song about how when I was younger, I thought that I could fix the world with a magic wand. But as I grew older, I realized that it took more than that because it's not a fairy tale. And so just enjoy this song. If it touches you, then it means that you need to do something about the situation around you. Enjoy this song.
When I was a little child, I was a dreamer. I thought I could change the world, holding a magic wand. Now I am older, I figured the world is just what you make of it. It's not a fairy tale, so I will play my part, making it better. Oh, I know they use me play. Ooh, my voice is here to stay. I know they use me play. My voice is here to stay. what you make of it. It's not a fairy tale, so I will play my part, making it better. I know they use me play. Ooh, my voice is here to stay. I know they use me play. My voice is here to stay. I know they use me play.
2 years is a lifetime when an enemy you cannot negotiate with is pursuing you. In January, when she said goodbye to her father, she did not know that that was the last hug she would ever give him. She revisits the memory like an overread love letter and wonders how a heart can continue beating through that much pain. In July, he receives an international job opportunity. Visa in hand, small allowance tucked into his pocket, big prayers tucked into his heart from his mother and grandmother and sister and all of the women who know never to let despair make a home in your heart. They turned 8 years old in December, and it was silent. Nobody was celebrating. Instead, they were told their parents had been claimed by the enemy. Confusion gripping their hearts and their small hands desperately gripping each other, they took a step towards an uncertain future. Alone, but together. I reach my hand out and remind you that everything we are can be found in the palms of our hands. Close it and think of power. Slowly open it and think of sacrifice. Remember that you are champion. Umumnobi, you are bingwa. A podium awaits you. After this lifetime, packed into 2 years, some will look at us and say we sound like funeral hymn and we make too much eye contact. But tell them that it is because we know loss intimately. We know what it is to run our hands over an atlas and hear the world cry. We know what it is to be called to a podium even as exhaustion claims our bodies. Even as our neighbors refuse to keep their masks on. Even as they tell you you look like painful memory. So you bite your tongue and choose your words. And tell them that herd immunity means the virus has nowhere to go, and you wish, oh how you wish that so many other Africans had had that protection, had had that option. It is not easy to get to the podium. You have to be brave and swift and relentless like the enemy you are fighting. You have to be willing to take one more step. Yiba umliba loya embili. Kupitisha mwenge kwa mtu mwingine. Pass the torch. Light up every space around you. Be a bingwa.
And I look forward to a future where COVID-19 is behind us and where the healthcare system has been strengthened to deal with pandemics of this magnitude. And the first step towards beating COVID is getting shots into arms. And how does that happen? The healthcare worker. Thank you, healthcare workers, for your sacrifice and efforts in beating COVID-19. We celebrate you today. And I call upon everyone, if you have not gotten your vaccine yet, please step up and step out and get your shot today. Thank you.
And I want to tell you the importance of getting vaccinated to protect yourself, your families, and your community. Let's stop pandemics by working together. Thank you.
I get medicines where they're needed in time to make a difference. You can as well make a difference by getting vaccinated and encourage your friends and family to protect themselves and the people they love to create a healthy future for all.
My name is Ugoma Obu, one champion for Ebonyi State, Nigeria.
I'm a champion of one for Bayelsa State.
I am representing Jos Plateau State.
I am champion representing Yobe State.
One champion Delta State.
I represent Kaduna State.
I'm one champion from Osun State.
The One Champion Summit has been awesome. It's the first time we're getting together for the year 2021, and from 2020 to 2021, it's been an amazing time getting to meet young minds who are doing great and amazing work.
The vision of One is to end extreme poverty and preventable diseases so that everyone can live a life of dignity and opportunity. So how can this come to play if we don't have policy that promote this?
This summit has really been very, very inspiring because I've met a lot of people who do amazing things in their own different field of work, and I am a person who advocates for persons with disabilities because I have a passion for it.
Experiences, knowledge is not just enough, but opportunities like this from One is really tremendous.
I get to connect and interact with champions from all over 36 states and FCT, and hear about how they impact lives through their works. Some are educationists, some technologists like myself, some are into health, and a lot of various things.
One provides opportunity to influence policy, and I am very happy to be lending my voice to issues around education and development, not just in Nigeria but globally, to ensure that we have a better world and no one is left behind. So for this reason, I would like to say a very big thank you to One for making this opportunity.
Is so much compared to what we do before. We have the opportunity of collaborations with people. I really want to say a big thank you to One for this opportunity, for the hospitality. It's been wonderful, and we look forward to doing more and working effectively with others.
Up next, the Future League asked global health and global development leaders from the African Union, Africa CDC, the Global Fund, One in Africa, AMREF, and IntraHealth, what's up?
SwitchPoint is about bringing great ideas and people together and working to find solutions to bring everyone, everywhere, a healthy future. I'm so moved with these young African leaders working to make a difference for all of us, working to attain a future we want, the future they want, one in which all people can survive and thrive. Thank you, SwitchPoint Future League, for all that you bring to the table. Up next, Future Leaguers will meet side by side with world leaders of their choice for some real talk and real action.
Welcome to the conversation. Up next and up first, we're going to hear from Franklin.
Hello, Franklin.
Okay, I'm doing good. Thank you.
Thank you very much, and nice to meet you.
So I'm happy to be part of. All right. No, I'm doing good. Thank you. So my question is simply, with all of the work we have been doing, I just wanted to find out what is the place of youths in getting some kind of positions in the international job market, for example, like AMREF, and what is AMREF doing to, put a place for these youths who are the future? Thank you.
Very good question, Franklin, and thank you for that, and amazing presentation by young people this afternoon. and morning. So the place for young people in job opportunities is huge. Appreciating that, particularly when you look at Africa, 70% of our population is actually young. And the good thing with the young people in Africa, they are agile, they are learned, they are smart, they are innovative, they are solution bring us to organizations, if I may say so. And therefore, the space for them is huge. But what is AMREF doing to ensure that that space is expanded and we facilitate young people actually to get into those opportunities? A few things, Franklin. One is that internally as an organization, we've actually come up with a youth strategy. So AMREF is 63 years old now. So we appreciate we have 63 years of experience in Africa. So we don't want that to be a hindrance for us to facilitate young people to get opportunities. And therefore, we've come up with a youth strategy, which is enabling us to do three things. One is to come up with technology that will enable us to be as agile as possible. That's important for young people. Innovation, ELPs, learning management systems, and all that facilitate young people to learn. And also to the governance piece itself within the organization. So giving young people opportunity to get into governance systems, the international board in our country offices, and also senior leadership teams in our countries, because it's through that we are able to mentor our young people. And then three, internally, we are also looking at our culture, asking ourselves, what is the appropriate culture for an organization like AMREF and other organizations that will facilitate young people to get opportunities, job opportunities, and that includes training them, coming up with mentorship and coaching opportunities for young people within the organization. So we have all that, but also ensuring the culture is facilitated for young people to work. Innovative learning culture, and also a culture that safeguards young people, appreciating that they are vulnerable compared with people who are much older and who are more experienced. But also externally, outside of the organization itself, because we are keen to look inward, but also to look outside and see how best we can support transformation across the continent. We also have a leadership and management course that we've learned for years, together with our partners like IntraHealth. And this learning management, the leadership and management system enables young people to get opportunities to actually learn competencies and skills in leadership and management, which are so important. And then what we are doing currently now, which is so important, is certainly to infuse those skill sets within the pre-service and in-service training curricula that is used across the continent. What that means is that when you get into college and you are doing a nursing course or any health course, any cadre, then you have opportunity to be trained in leadership and management. And therefore, when you get out, then it becomes easier for you to fit in leadership and management. And of course, also we are considering in-service, because there are also millions or hundreds of thousands of young people who are also in positions that can easily be graduated to management and leadership, wherever they're working, whether they're working in NGOs or they are working in ministries of health. We think there are opportunities there. So we see that as important, Franklin, doing it internally as an organization so that we also become a learning organization for other NGOs, which is critical, but also two, contributing also to the whole job ecosystem or health ecosystem where young people should be able to get opportunities. I hope that helps, Franklin. But for you, I also have a question. Can I ask you a question?
Thank you. Yes, thank you.
Franklin, having said that, now where do you see yourself in the next 5 to 10 years as a young health leader or health manager who is coming up, who has so much energy and so much vision for Africa? Where do you see yourself?
Thank you very much. I'm Dr. Franklin, epidemiologist, bio expert from Cameroon. Sorry, in Cameroon, yeah, we had it's the rainy season, so the weather disturbs the internet connectivity. But I must say, in 5 to 10 years, I see myself in a high office as a global expert who is going to be renowned and bringing in added value to the setup that I'll be working. And also, I wish to be at that high office because I'll be able to influence policy, domestic health financing, health security in Africa, and all the like. And I see AMREF is doing a lot in terms of health equity, trying to promote the values and things like that. And I mean, I want to be in a position where I will be able to mentor the other people that are coming behind me, other youths, and that will align with my advocacy symbol, which is the light bulb, trying to shed the light and helping people to make it to the next level. So I'm hoping that in the future I have something to do with AMREF. Thank you.
Thank you, Franklin. Count on our support and always welcome to AMREF. Thank you very much. Thank you.
Great. Thank you so much to Dr. Kamathi and Franklin. Up next, we're going to hear from Zipporah.
Hello, everyone. Hi, Janet.
Hi, Zipporah. How are you?
I'm very fine, thank you. It's so amazing to see you here again. And I just want to say before I introduce Janet, who is an amazing leader doing amazing things, just want to say in my time in Future League has given me the opportunity to learn about my country's health and how it is financed from different sources. I realized that in the medium term, that donor funding and donor resources are going to be important for us to keep saving lives. In particular, I have learned how the Global Fund has continued to support the frontline workers, and not just in Kenya, but other countries as well. I truly appreciate that. So thank you so much, Global Fund. And just to say on behalf of the Future League, that we support the Global Fund's replenishment later this year in hope that the Global Fund can keep saving lives and reinforce our healthcare system so that the youth can unleash their potential in making that future come to. So just introducing Janet. Like I said, she's an amazing leader. Janet Mariaki is currently IntraHealth's acting senior director of healthcare workforce development and the Kenya country director. Previously, she was the program lead for USAID funded Human Resources for Health, Kenya Mechanism, technical director, and deputy chief of party under the Human Resources for Health Capacity Bridge and Capacity Kenya project. She is a medical doctor and a public health specialist with over 18 years of experience in the healthcare sector. Janet has provided strategic, technical, and through thought leadership in human resources for health, medical education, health system strengthening, quality improvement, and service delivery, while activating broader thinking at global level, national and subnational levels, as well as private sector health development. I mean, when I grow up, I want to be you, Janet. And so my question to you today is, we as a Future League are young leaders who have come together to discuss the kind of future we want to see, specifically the kind of health, our future for health we want to see, 20 years down the line, 30 years down the line. So my question to you is, what investment do you think should be made then for the upcoming young healthcare workers to ensure that we get to that future we hope for? Over to you, Janet.
Okay. Thank you very much, Zipporah, for the question. I'm glad to be able to interact with you today and also to be on this panel. I think the most critical thing when I look at investments for our health workers, especially young professionals or those who would wish to continue to pursue a career in health, critical is advocacy around health financing, because without the resources on the table to support our health workforce, especially the young, it is going to be very difficult to have and experience that journey as a health worker. So for us within IntraHealth, we are driving the advocacy agenda around for our donors and partners to support the health workforce. And with these resources that could be availed, I think critically is working at ensuring that medical education is supported. Young students who are pursuing a course in medical, in public health, or even as a doctor or as a nurse, will need to be secure in terms of school fees. So it's critical to look at where are they going to get this? Is it possible that the family will be able to raise this? If not, can they secure a low interest rate loan or even a scholarship? This is work that IntraHealth has been able to support in a variety of countries. Secondly, is really ensuring that we do have decent work conditions for our health workforce. And within those work conditions, are they free from issues as sexual harassment, gender-based violence, especially for the for young ladies? Are they getting the right and fair pay so that they can feel motivated? Are they able to work in rural areas alongside the urban areas? And for me, my call is for the young people to also see opportunities to work within the rural areas. And this will only be possible if there's attraction and retention, and there's also supported by infrastructure. So it calls for ministries of health and partners to support intersectorial collaboration to ensure that there are roads so that the patients can come to these young health professionals. There's electricity, there's water, so that the health professionals can be able to provide the services that are required. The other thing is ensuring that there are tools to provide the services, especially when it comes to primary health care. So is there a stethoscope? Are there equipments to even do ultrasounds? Are there, or the laboratory infrastructure for all investigations so that the diagnostics towards the diseases that our patients have are actually supported? In addition to that, I think critically is also data. There's need to ensure that on the ground there's information being collated and being analyzed on availability, on skills mix of the health workforce. Where are they in terms of their distribution? What are the gaps in terms of competencies so that they're able to be supported for further in-service training? So I think briefly that is what I would talk about investments for our health worker, alongside ensuring respect from the community and those who are their employers, respect and recognition also through government documents such as schemes of services, and so that there's also career progression. We do not want our young people to stagnate. And security for employment when they graduate. I think that is only possible when there are resources and there's infrastructure and policy and structures for better planning and management of our health workforce.
Amazing. Thank you, Janet.
Okay. Thank you for the question. I do have a question for you, Zipporah. And I would like to know what makes you so dedicated to global health. How do you think we could encourage more people like yourself to get involved as health workers or advocates for global health?
Thank you so much for that question. I think the biggest why for me in global health is because I truly believe that health is a basic human right for everyone. You know, at whatever country you are, whatever corner you live in, whether in the village or urban areas, I believe that health is a right for you. Me, both in the healthcare and in other sectors, just being able to learn from them, seeing seeing and learning from them what has worked in their countries, and how can I borrow that to ensure that health is also developing in my country, and to see also like what is working in my country that I can sell to them, or that I can teach them to grow in their specific countries. I believe global health now gives us that opportunity to continuously learn from one another, even as we work in the developmental goals, that we ensure that me from Kenya to ensure global health give us now the opportunity to learn from one another and ensure that we are sharing ideas and sharing strategies to help us move forward into the future. People like that should be made for us. Correct education. There are many opportunities in front of us, has the potential. So if our education right to give us skills in research, because data is really important even as we move forward, to give us skills in using at hand able to who can able to give them the proper opportunities to get to where they want to be, then investment to making young people that now seeing as that the future belongs, everyone is part of the conversation.
Yes, thank you for that response, Zipporah. And we wish you all the best in your future endeavors.
Yes, thank you so much, Zipporah and Dr. Mariaki. Up next, we are going to be hearing from Deborah. Take it away.
Hello, Dr. Kaniki. This is Deborah, Drone Pilots. How are you?
Hey, Deborah, I'm okay and very happy to be here.
I'm privileged also to finally meet you as I look forward to be one, as I look forward to also grow into your position one day. So I'm yet to hear more from you as the head of, as the senior public health analyst in the office of the Director of Africa, CDC, and you coordinate in the African Union COVID-19 vaccination Bingwa initiative. And I also know you as a professional doctor and who is looking towards advancement of innovative ideas which you think will spur to seek out new frontiers and knowledge and advance in your course. So my question to you is, okay. The question to you is, Dr. Kaniki, as a senior public health analyst who's looking towards advancement in innovation ideas, like contributing towards advancing innovation ideas, how do you plan to scale up and promote inclusiveness and fund new health technologies made by talented young innovators in Africa who really understand and they really have been went through the health problems in Africa, aside the potential of the emerging technologies such as drone technologies and digital solutions already in use in the public health sector. Over to you, Dr. Kaniki.
Thank you so much, Deborah, and very privileged to be on the panel today. I also want to congratulate the 4 panelists who just came before us, and thank you to SwitchPoint Future League for the invitation. It's a very amazing panel today, and since the beginning I've been following the work that has been done by the Future League. Very, very amazing. So I wanted to start by there. So coming back to your question, let me say that first, like as Africa CDC, since the pandemic started, we've been thinking of innovative, technology in the health sector, and since we saw what COVID-19 has done to us, like kind of lockdown, we started having this kind of virtual meeting or working from home. So we thought that these are kind of innovative idea that we need to support. So let me take an example of what we've done at Africa CDC, and which is something that has really been quite impressive, and it has brought a lot of achievement. We have this one of the 12 initiatives we have at Africa CDC during the COVID-19 pandemic is what we call a trusted travel, trusted health. And the kind of achievement that I can mention is like end-to-end stakeholder onboarding that has been brought almost 30 countries. Some lab that have started working like kind of digitalization of their work, and over 7,000 lab and clinic onboarded, and that is only in Africa. So I don't want to go far from that on that initiative. So in terms of young people, what can we then do to promote that inclusiveness and fund the new health technology made by young people? I think there are 4 things that I'm looking at. First of all, at Africa CDC, as I said, Africa CDC is a young organization, just 5 years old, even though we have achieved a lot in this the past 5 years. So I'm looking at things like four things. First of all, it's make sure that we are training people, those young people, or guide them in those ideas that I have. We need human resource to be trained, and they need to develop those ideas they have. And that is not enough. As I say, we need four things. I'm looking at four things. We need to create enabling environment for young people to really express their idea and their innovation that can be of huge impact in public health sector. And also, we need to mobilize resources because those ideas need to be funded, as per your question. So we need to be mobilizing resources that can help those young people to fund their idea and then help them to develop them. And to make sure that we are mobilizing those resources, we need to engage all the stakeholders. And actually, we are saying that health security is not only in the health official or health experts. It involves so many stakeholders, from peace and security to governance, agriculture. So all the stakeholders that we need in this area, we need to bring them on board and sit on a table and discuss, like, guys, we need to support the young people in what they're doing. And just for example, what you guys are doing is, we need to support the young people. Myself, I'm a young people. I'm talking on behalf of young people. So we need to support young people and bring them on the table. This is what, even at Africa CDC, we've been given this privilege to be working at this kind of position to show like young people can, at this moment, be innovative, bring some idea on the table, and that can be solution to our problem in the public health sector. So I think from my hand, those are the ideas I can add. I think as I say, train people, creating an enabling environment, mobilizing resources, and also engaging all the stakeholders that can support those ideas. I would like to go over, but I'm trying to keep my answer ratio to allow if there's any other question coming after. But if you don't have a question, I have another question for you.
That's really insightful, Dr. Kanik. You can go ahead and ask me a question. Yeah.
Yeah, since you've said it before your question, like you are one day expecting maybe you have to take my position, which is something that I really encourage. Yeah, at Africa CDC, we have spaces you can come and join us. So my question is, how is the drone technology industry impacting life, and what does that say to you as to you and your fellow young innovators?
Okay. First of all, thank you for such an important question, which is close to my heart. Every day I think of it. In the first place, drone technology industry have proven to exhibit a very huge significant role in contributing to the development of African countries. In this case, we're talking about Malawi. So I'll give most of the examples that have happened in Malawi in drone technology industry. In my case, I had first get introduced to drone technology in 2018 when we had when I was involved as just a volunteer to respond to floods. So later on, I had the privilege to also join the first African Drone and Data Academy, the first drone data academy outside USA. And after graduating from the African Drone and Data Academy, I was able to qualify for a drone pilot to join Wingcopter, drone German startup company. But one thing that I wanted to highlight as an important thing is the graduates from the African Drone and Data Academy are participating in a number of health projects, for example, including myself. We are talking about drone and data aid project that is currently running in Malawi to respond to the to respond to the COVID-19 pandemic vaccine dissemination, and we are also we also have like responding to emergencies of higher maternal and infant mortality rates that are currently in Malawi. So we've had examples where we responded. Let's say the health remote center could call for oxytocin to respond to help the women that are delivering and have loss of blood. So I see that it has its levels and it has a huge impact, starting from a low level to higher paid personnel. For example, we have been involved health workers to receive these health commodities, and they also had like student and lab sample referrals to us so that they can quickly get diagnosed and sent back to the health centers. So in that case, we corporate is trying to focus to strengthen the to strengthen this response in accessing healthy care. You see, so we have had a lot of we had had improvement and in preventing the actually improving the healthcare access by healthy workers and as well as individuals in that are located remotely in health centers. So one thing that I need also to share with my colleagues that are healthy innovators is that the space of digital solutions and drone technology environment is just too broad, and there are so many things that are getting discovered that I think we need to catch up and we need to catch up and use the best of our knowledge to help people that are living in their health centers. I mean, the remote located health centers, even the people that are in our community, that 80% I talked about that is already existing in their remote health centers, to help them access those type of health services. And by the end of the day, meet the well-being of the people and include everyone in the system for healthcare services.
Wow, so impressive. That's good. I'll not. I can see that CJ is already here, so we keep this. I would like to say that we want to keep in touch with the team, you 6 guys, and I'm looking forward to work with you in the Bingo initiative. You guys are really doing a good job. So
I see as your initiative. I see as drone technology to be one of the most important factor to meet the Bingwa. And then
exactly. So let's keep in touch. I'm looking forward to working with you guys. Thank you so much.
Thank you. Bye bye.
Thank you both. Thank you, Deborah and Dr. Kaniki. Really, really honored to have y'all here. I'm really enjoying all of this wisdom. Up next, we're going to hear from Frank.
Thank you, CJ. Hello, Mr. Samson. Very nice to see
Frank.
you again.
Nice to see you. I seem to be having a problem with my camera. I don't know why, but glad to see you and nice to be here.
Yes, it's good. We can hear you well, so we'll take your voice for today. All right. So it's my honor to introduce Samson. He's the chief of pride in, aka the boss, at IntraHealth International in Rwanda. And Mr. Samson, I'm going to go directly to my question. As you know, Rwanda has a unique history in a way that we are somehow burdened or supposed to live with our history, which was the 1994 genocide against the Tutsis. And, that brought a lot, but mostly the intergenerational trauma that young people that are born after the genocide carry with them. And also, COVID-19 itself has brought in its own forms of trauma all over the world. And so My question today is, how do we look at trauma and mental health? Because, you know, mental health issues arise as a result of all this trauma. So how do we look at holistic healing and really finding a way to move this trauma, both technically but also on a personal level? Yes.
Thank you so much, Frank. This is a great question. I think you asked me a $1 million question. And frankly speaking, it will take a long time to really answer this question because it's a complicated one. But it's true. I mean, to start with the genocide, it is true that trauma can be intergenerational. And when you think about the genocide against the Tutsi in Rwanda, you know, 30 years since this tragedy, unfortunate tragedy happened, we still have people that suffer from the impacts of the genocide. And that includes people who were not even born then. So there comes the intergenerational impact of the genocide. And, you know, trauma, you know, I'm glad we're having this conversation because trauma issues, and especially as they impact mental health and health in general, are things that are not commonly talked about, commonly discussed in health discussions or public health discussions. And but trauma is a very much a global health and a mental health issue. Something that we really need to put at the center of all our conversations around global health, and particularly as given the impact on people individually, families, communities, and even entire societies. Acts of genocide, epidemics, pandemics, you talked about COVID-19, and other kinds of tragedies can result in lifelong mental health issues for people at different levels. And these are things that need to be brought into the public discourse, discussed, talked about, and you know, solutions brought to the table. But the question is, the big question for me is, how do we deal with these issues? How do we deal with issues of trauma? How do we deal with the impacts of trauma? And especially in the global health sphere. I think there are two most important actions that we should think about, both at family level, global level, society level. I think one is to come to the realization that trauma does impact mental health. And with that recognition, we need to come to the second thing, which is to make sure that we have in place systems that support, that help people with mental health issues that have suffered the impacts of previous trauma to be able to access healthcare. And that is very important. I mean, there are various forms of help that people can receive, or care that people can receive or seek. There's psychosocial support, counseling, there's clinical care, treatment, you know. There is also therapy. And that can come in various forms, in the forms of you know, use of art. You know, people like you who are in this field can contribute, and through music, poetry, dance, and storytelling. These are really different forms of therapy that can be made available. So I think that that the society needs to come to the realization that, you know, trauma does cause problems for our society, and that we need to put in place systems to address them. We can only create change by action, not by sympathy, because many times when there is tragedy, we tend to sympathize, and we send messages to kind of, you know, condole people. But we need to move beyond that. and make sure that we have in place systems, strong systems that can help us address the impacts of trauma, the effects of trauma on health of our families, of our society. So that's what I would say, but in summary, but there is just a lot more that can be said about this subject. And I do have a question for you. I don't know if this is okay.
Yes, thank you for your answer. It's yes, thank you.
Right. I mean, so
And go ahead.
As a young artist, who is pursuing a career in art, I would like to know, do you, in your view, think that artism has a role or can contribute to a healthier society? And if so, how can that happen? How can young people like you make that happen and make a contribution in terms of improving health or global health?
I definitely do believe very much in the power of art, especially when it comes to holistic healing, like I was mentioning, because I think from my own research and from my own personal experience as also a young person born after this genocide that we were talking about, and also having gone through this pandemic that brought the world to its knees, it has been dance and it has been art that has always guided me. And I think the role of art, and I'm gonna speak mostly about dance because dance is my main art form. I think that the trauma is always stored in the body, and obviously we are experiencing this life through our bodies. So for me, I think the first vital thing in this human experience is having that deep connection with our bodies. And so with dance, I find that the more you move and cultivating this relationship with our own bodies, you find that after a while, you realize that there's stuck energies in different places of your body. And that's when embodiment and movement practices come in to really help us move these stuck energies. And also, it's a way to express. A lot of us just want to scream and shout and dance it out. And so it's one way to express, from inside out, to really release all these emotions that are within us. When it comes to poetry, when it comes to writing, it's writing down these things that are weighing us down heavy. So I think that the role of art is great. And I think, and actually for me, it's also my mission and dream to contribute to my community in this way, to really bring these embodiment practices and to tell people that, listen, yes, we're going through all these, and there's ways through which we can express, through which we can move these energies so that we can, step into more power in our lives. And I think only by holistic healing and truly moving on is how we can then build a new society that is, that is healthy and alive and ready, especially because we are very many young people. And CJ is here, so that means I gotta bounce. But yes, thank you.
Thank you, Frank. Excellent, and good luck with your career.
I'll see you in Rwanda soon.
All right, thank you.
All right.
Thank you, Jenny. Up next, we're gonna hear from Sil.
Hello, CJ. Hi. Hi, Mr. Edwin.
Hello.
Hello. Good afternoon.
Good afternoon, Sil. How are you?
I'm good. It's so good to finally sit with you virtually, even though.
Of course.
So, hi, everyone. Good morning, good afternoon, good evening from wherever you are viewing this. I am sitting and having this chat with Mr. Edwin Ecoria. I hope I pronounced the name right. Is it Ecoria?
Very right. Yes.
Edwin Ecoria is the executive director of One Campaign here in Africa. And I don't think that it's a pleasure having this conversation with you. I'll just go straight to the question. So reading about you, I discovered like that from your wealth of experience, you've worked for over in the last 15 years on transparency, specifically with public finance, health, agriculture, and many sectors. I'm just interested in learning and knowing what has been your greatest challenge so far, and also your biggest lessons. I just want to learn from your wealth of experience.
Hey, thank you, Seal. And like I said, I think we're just going to speak frankly. One of the biggest challenge is that we've been asking and demanding for finance in the social sectors, especially health. And what we've seen is that as we are calling for, more higher budget allocations to health, we also realize that the bigger bucket or the pie is still too small. So even if Nigeria puts, say, 15% of its budget on health, the question is, what does that amount to, given the challenge, right? Given the size of the problem, and this is the same thing across Africa, where the investment that is needed, the gap in financing, is so large that you need to really be prudent in managing what you have, and I think that's the biggest challenge because the basket is so small, the overall sum is so small. Whatever is put into the health sector, for instance, needs to be properly utilized. And that's what we're not seeing yet. We're not seeing that high quality utilization that is transparent, that really translates to proper service delivery, value for money. And that's one of the biggest challenge that for me, has been, as you advocate, as you try to push, as we ask for transparency, we look for the procurement system. Are the procurement systems the right procurement systems? Are the medicines and vaccines and hospital equipment and primary healthcare commodities or any of this, are we getting value for money? And I think that's where the challenge has been. And I would say that it's still a challenge. And that's why we constantly ask for global support and global partnership so that we can catalyze whatever funding that we get can actually go the extra mile in resorting to service delivery. So one of the biggest lessons I agree is for me again is that because of the challenge of the right use of resources, the question is, should we be asking for more money in a broken system? And that is the questions we are all asking ourselves. When the system is broken, should you be asking for more money, or should we be asking that the system be fixed so that whatever money comes in, right, then it can do the most it can? That is still a challenge we are still contending with. And I hope that, I hope that is something that we can.
That was such a good answer.
Yes.
Wow, amazing.
Okay, and for me, I would also use that to turn around and ask you your own question. You are singing just the beautiful song you just did now in terms of dreaming. The question is, knowing that storytelling has been part of our culture as Africans generally, it's part of the way we express ourselves. So how can you see, I'm worried of calling you the younger generation because I still feel young, right? So how do you see how we can do storytelling really, especially through music and poetry, to impact global and local, to impact social change, both in the global system as well as in a local setting? How can we really utilize that storytelling capability to really inspire change, or at least to see that change happens?
Yeah, thank you so much for your question. So when I was a child, when I was growing up, my dad back in Benin used to be like a very good storyteller. He's still a good storyteller, but he doesn't say so much stories as much as he used to. But like, I didn't have much memories from my childhood, but like all the stories my dad told me stuck with me. And it was his way of just teaching us lessons, because stories are very relatable. They're simple, they are straight to the point. They make you feel like you're part of the decision making without necessarily like receiving instructions, So that really helped me in shaping my mind. I feel like people don't like to be told what to do. Society is structured in a way that people want to feel independent. But if you tell stories, people feel like they're part of the decision making. They feel like they're the ones actually making decisions. They feel inspired to, move better, move right, do the right thing. So I feel like from my own experience with how storytelling has shaped my life, I put it in my music because I feel like people will listen more. People are more inspired and people easily relate with these things that we're talking about. When you put these issues into a story format and into music, it becomes more engaging. It's both educative and it's also entertaining. So I think that storytelling is the way to go when it comes to advocacy. And yeah, I'm here for all of that.
Amazing. Thank you so much, Sila, and thank you for the great work you've done, particularly with transparency and accountability and demanding for that. I think that will be it from us. CJ, we're coming back to you, right?
Yes. Thank you so much. Thank you, Sil. Thank you, Dr. Ecoria. Up next, we're going to hear from Yared. Are you out there, Yared?
Hi, CJ. Yes, I'm here. Yes. Hi, Calypso. So I'd like to introduce Calypso Chalgadu, who is the founding head of the Global Fund's Health Financing Department. And her CV and accolades are too long for me to go through, but she's been a leading voice in health financing. She set up multiple organizations to support effective decision-making around the world. So I'm really glad to have the opportunity to pick her brains. And what I'd like to ask is, given the current economic situation in Africa, and this tends to shape, the amount of money that's made available to health, where does this leave African countries in terms of increasing the resources for health, and how can the youth get involved in this?
Thank you, Yared. Well, it's a difficult one because as a global crisis, really, Africa is not alone in facing a very uncertain economic outlook. But Africa is perhaps more sensitive to the shock after COVID, and now with the war in Ukraine and the growing prices of commodities, of fuel, of food. So these shocks are felt acutely in Africa and exacerbate pre-existing issues. And so that means that there will be less money available for government to spend, including on health. For instance, the COVID pandemic widened the deficit, the average African deficit, to 7.6% of the 2020 GDP. Even as governments had to soften the damage from the lockdowns, countries had to take more debt than usual, and this means higher interest payments for the loans they were taking, up by an average of 16%. So 16% of government revenues going towards debt servicing. But in some countries, this could be as high as 50%. So half of what the government gets, the government budget that the government has to spend on things, on education, on health, the social sectors, half of that goes towards servicing the debt. Africa is experiencing high levels of inflation in core commodities, food, oil. And so this is a really serious issue. It's acute and increases the cost of living for people, especially those people that are the poorest, the most vulnerable, they're sick. So all of this is to stay in most countries. And so most countries will not have much money to increase the spending on health. So spending money more efficiently is quite important. And we heard this from the previous speakers, but countries will will struggle to maintain the current levels of spending, even though current levels are way below what is needed. And we talked about this earlier. Now, this is only one side of the equation. Countries can increase resources by adding more resources, yes, but also countries can use their existing resources better, right? One of the main sources of inefficiency, for instance, is procurement of commodities, of drugs, which for many diseases provide the most or the only cost-effective treatment solution. In public facilities in Africa, countries can pay 34 to 44% more for essential medicines compared to international reference prices. Even neighboring countries in Africa, one country will pay 5 or 6 times more than its neighbor for the same drug. So huge variation, huge inefficiencies, huge potential to generate additional resources by saving money without affecting the quality of the care. Another issue is that many countries don't have frameworks to assess what types of medical services and drugs and commodities they ought to be financing, investing in. So health technology assessment institutions, guidelines, local capacity, and Africa CDC is building some of this capacity, the AU, the ALM, the scorecard, all of this is really critically important for the region and individual countries. And some countries, for instance, say, well, in our constitution, we'll put all healthcare will be free. But in reality, that's not going to happen because the resources are not there, the drugs don't get to the facilities, healthcare workers are not paid on time, And so it could be on paper that everything is free for everybody, but in reality, that's not the case. So countries require informed decision-making, what we call strategic purchasing, to guide the way they spend their health money. And this could be through costing essential benefits packages, for instance, and prioritizing and negotiating better. So countries can use their limited resources to get more health benefits. Another issue is public financial management systems. So what this means is the way a country manages its own resources, all the way from designing the budget to spending the budget. A lot of the time, there's a lack of predictability. So sometimes budgets are overspent, but a lot of the time, and this is shocking, in very poor countries, budgets are underspent. So you have countries that have very little money, and yet the government allocates resources for health, and yet these resources are underspent, they're not spent. So on average, 20-30% of the approved budget never gets spent, never gets utilized. And this is really a big shame. So how can you ask for more money when the money allocated is not even spent, let alone spend efficiently? So these are some of the problems that are quite tangible. It could be tackled, irrespective of whether the economic outlook is favorable. In fact, the worse the economic outlook, the more the pressure to resolve these issues. These may sound technical issues, but this should not discourage you from learning more about them, studying them, understanding them, and pushing. The youth can be involved in a number of ways. Study the issues, learn the language, like you are doing. You're super informed. This conversation shows that. You're passionate. Become involved in shaping policy decisions. Hold your leaders to account. Join forces with civil society organizations to push for reforms. Hold the governments to account for their reform agendas. And lastly, continue what you're doing. Have conversations with experts, with policymakers. Put a spotlight on the issues you see in your own countries. Use social media to get others involved. And demonstrate the youth cares about health financing. Ultimately, many of these decisions come down to political desire. The decisions that will influence you, your friends, your family, your community. The decisions you can influence and you can change. So shall I ask a question?
Sure.
Okay, so my question, I guess, is you've talked about growing up in Zimbabwe, and of course, you're very much into the understanding the political economy of healthcare and policy in Zimbabwe. So what stands out most to you in terms of health financing landscape? What is the situation? Where can the changes happen?
Yeah. Well, there's a lot going on in Zimbabwe, and a lot of the trends that you touched on, whether that's, the budgets aren't spent, there's no way to purchase things strategically. A lot of these trends that you see in Zimbabwe, same trends you see in Africa. So learning that wasn't too surprising. But one of the main things that did stand out to me was that many of these issues are addressed in policy statements, in strategies in Zimbabwe. The government has strategies and policies to address this. And sometimes these policies date back as far as like 2010. So, for instance, the Zimbabwean government has said they want to develop essential medicine package or an essential health package, but this has never happened. Another thing, we're talking about the high cost of procurement of medicines. So SADC, the regional economic bloc or community, has said that they're going to develop a pooled procurement platform to increase, to decrease the cost of purchasing drugs in Africa or in that bloc. That was initiated in about 2012, so nothing's happened. So in many cases, what stood out to me is that Zimbabwe knows what it needs to do, but the actual reforms are lagging the policy and the strategies by too many years, and it's not acceptable. And one of the main things I got from the Future League was, I got the chance to put, a face to some of the statistics that you sometimes read. And so, I had the chance to speak to an airtime vendor who I drove by in Zimbabwe, maybe for the last 10 years, I used to drive by. And I got a chance to ask him, what are some of the issues you have with accessing healthcare in Zimbabwe? And he was saying, often there's no drugs. I can't buy drugs. When my wife was pregnant, even though the Zimbabwean constitution says that pregnant women should be afforded free healthcare, she was turned away. So that was one of the main things that stood out to me from this experience. I got the chance to really put a face to some of these statistics. And I just like to say that, this airtime vendor, he was really optimistic about the future. And all he wanted was that the government should spend more. And I can only echo that sentiment. So that's all from me.
Thank you. So waiting for CJ here. He is.
Yes.
Yes. Thank you so much, Yaed and Dr. Chakadu. We're going to have a few closing remarks from our world leaders. So I'd love to welcome back George, Janet, Chris, Samson, Edwin, and Calypso for just some closing remarks and advice to Future League and future collaborations. So yeah, short and sweet here as a closing, but I would love to hear from you all. Sort of in this order, we're gonna hear from George first, then Janet, then Chris, then Samson, Edwin, and then we'll close up with Calypso.
CJ, thank you so much, and this has been amazing. My one thought to the young leaders, global leaders that are here today, is that access to healthcare is access to justice. So, and that has to be in their hearts as they work. So I would encourage them to apply a justice lens in everything that they do, whether it's in the service that they offer every day or in their engagements with the communities, with the governments, and asking themselves every day, what did I do today to contribute to removal of barriers, structural barriers that continuously deny our people services, very basic services. And therefore, when a mother is unable to access a facility for FP, for delivery under the necessary care, that is injustice. And therefore, that has to be the lens that they have to apply in their work. And let them be the voice of the voiceless, the voice of our people who are in fragile countries in Africa, the voice of excluded communities in slums, in rural areas, the voice of populations within those big communities that are also excluded. I think that is how they ensure that they become part and parcel of ensuring that no one is actually left behind. Let them put a justice lens in everything that they do. Thank you, CJ.
Yes, thank you, Dr. George. And then let's hear from Dr. Mariaki next.
Thank you very much, CJ. I think for me, just building on what George has already shared, is I want to call on to our young health professionals to come into the health sector with an open mind, to be compassionate, to be empathetic to the patients that they will be looking after. But at the same time, also not to be discouraged, especially when we have all these challenges about pay or working in rural and hardship areas. I think if the call is from the heart, then you'll be able to give it your all and allow then your health managers, your policy makers, then to help unlock the challenges within the sector. So my call is towards primary healthcare availability for our health workers. And at the same time, I want to ask the young Future League leaders and others, millions who are out there, really to support the advocacy agenda towards better health financing, to meet their budget declaration, to also and emphasizing further on health workforce support within the health system, because the health workers are the cogwheel that moves that entire system. Without health workers, primary health care will actually collapse. Thank you.
Yes, thank you so much, Dr. Mariaki. Dr. Kaniki, are you still here? Chris, you still with us?
Oh, yes, even though I've sat in another meeting, but at least I'm still here. So just a few words. Let me put on my camera, sorry. It was amazing attending this panel, really, and I'm quite really impressed by the work that our Future League are doing. And I'm very proud because myself, I'm still young. Yeah, I know I'm a young person. So what our colleagues are doing is a very good job. And what I'd like to tell them is keep doing what you are doing and make sure make sure that you have our support. And as I said, you are my bingwas. As for the Bingwa initiative, is bingwa means it's a Kiswahili word that means champion. So for me, you are the champion in what you are doing, and as champion, we are here to support you in what you are doing. Yeah, I don't have so much to say, but I'm very, very happy to see what you are doing. And in any way, if you need our support, we are here to collaborate. And yeah, thank you.
Thank you so much, Dr. Kaniki. I know that many of you all world leaders on this call are wearing many hats, so I appreciate you all taking some time today to share your wisdom with us. Dr. Redini, are you there?
Yes, I'm here. Thanks a lot, CJ. And again, apologies that I'm not able to show my face here. My camera kind of malfunctioned, but I hope you can hear me well. It was great to really hear from the Future League leaders. I could sense and see the passion and the enthusiasm in each one of them, and I think, and I believe that they really have bright careers ahead of them, and I think they have the determination that we need to see in young people to really make our world a different place. Despite centuries of advancement and progress in health, our world still bears a heavy burden of several threats, pandemics, epidemics, and other kinds of threats that we see in health. And we need a world where we continue to think, where we continue to innovate, where we continue to explore ideas that can help us to really be better prepared for what is coming in the future. The threats will always be there, but the question is, how well do we prepare for those threats? And this is where I see the young people coming in. They have ideas, they have innovations. I mean, I work a lot with young people now and in the past, and they have great ideas, and I think those ideas need to be harvested and curated and applied to be able to address global health issues. We need more and more actors, we need advocates, we need champions, we need innovators, and we need to bring all those people to the discussion table, and particularly those young people. And I believe they have a role to play in making our world a better place. We need their voices heard, and we need to make sure that we listen to what they say and give them the space to actually actualize some of the ideas that they help us to keep the momentum for engendering health. Young people have the talent, they have the skill, they have the passion and the determination to create change and to make a difference. And so I believe that we all as global leaders need to create the space for them to be able to do that, so that they can realize and actualize their dreams and be able to see themselves as leaders now, not leaders of tomorrow. That's what I would say. Thank you, CJ.
Yes, thank you so much, so much. Up next, we are going to hear from Dr. Edwin Ecoria.
I wish I'm a doctor, and not yet.
Oh, I'm sorry.
I would soon get a PhD. Don't worry.
Sorry.
Okay, so I think the key thing I wanted to share here is that these young people are the wings beneath our wing, are the wind beneath our wings. In that their voices are voices of accountability. They are voices of the future. They basically describe what they want to see, how they want it to operate. And if we do not come alongside with them, then we're not creating any future. So because they own the future, they should be at the table. They should be sitting here. They should be having these conversations. They should be contributing to the decisions we're making. They should understand the implications of these decisions. So basically, we need to improve the accountability ecosystem that enables global leaders, policy makers to be accountable. So if they stop talking, accountability is not intuitive. And so we need to continue to hear them loud and clearly. They need to demand a seat at the table, and they need to make their voices heard. And I think that is what this Future League has kind of exposed now. And we hope to see much more of that as the future breaks. Thank you very much.
Yes, thank you so much, Mr. Aquaria. And our final word will be from Calypso Chakiju.
Thank you. Thanks very much. Well, I'd like to close by calling on all of you to support the Global Fund's seventh replenishment. We need $18 billion to get back on track in our fight against HIV, TB, and malaria. This will also be used for catalytic investments to increase and improve countries' healthcare investments around the world, but especially in Africa. We're going to use this money, we're going to multiply it, working with African leaders to get results. I would also urge you all to keep advocating for healthcare reforms in your own countries. Your voices, the voices of the youth, are an important part of this conversation. Keep it going. Never give up. We depend on you. Thank you.
Yes. There's so much wisdom on the panel today. So excited to be a part of it. The young people are our wings. Because they own the future, they should be at the table. We have to create young space for young people to be the leaders of today, not tomorrow. Health is justice, and health workers are the cogwheels that make all the wheels turn. So much wisdom today. Thank you to our future leaguers, and thank you to our world leaders who joined us here today. Thank y'all so much. It is the voice of the youth, the league of the future, reality made manifest with the vision of a child, brilliant minds, making magic across the world, finding joy in the darkness, hands joining you in the work, the heavy lifting, unafraid to have the hard conversations. This is a letter to the bodies of the youth. You are alive. Know that. You are free. Know that. This life belongs to you and no one else. Know that the body is not always what they tell you it is, that it is a vessel for you to dance with, to learn the steps, how to fly and land grounded. You are not stolen. You belong to you. You are tapestry, woven perfect, not flawed in birth, on God and goddess and universe, complete and flawless. Feel your ancestors, your connection, your wholeness, your holiness. You are worth the world and some. You are the voice of the youth, the league of the future, reality made manifest, a brilliant mind, making magic across the world. Thank you so much for joining with us today. We love hearing your ideas and we want to hear your voices. Here is your send-off challenge. In the next week or two, record a 1-minute video message to the world, to your finance minister or your health minister, to your friends or your favorite newscaster, explaining why you think supporting global health helps your country thrive. Tell us about the future you want and send it in to us, or post it, tag it SwitchPoint Challenge, and send us a link at the email in the chat. We really want to hear from you, and we will feature selected talks from you at future SwitchPoint events. Thank you for your ideas and energy, and let's not stop here. We can keep the conversation going at SwitchPoint Participate. Click on the link in the chat. Stay in touch with us. Over the course of the coming year, we have multiple events planned in person and in the virtual world. Sign up for updates and announcements at the link also in the chat. Thank you for being here today, and deep thanks to the Future League for sharing their ideas, dreams, and goals with us. And thanks to the Global Fund, One in Africa, and IntraHealth. From all of us here, see you soon again.